Story 1-1. Do not get too attached to your birth plan because there is a good chance that the whole thing will change at any moment. No one warned me about the catheter. Story 2. Nobody told me I might throw up during labor. I was so mad. Labor and vomiting? Whose idea was that? Story 3. I shook like a leaf for about an hour after giving birth due to adrenaline. I was shaking so hard, teeth chattering, that I was not able to hold my baby for a little while. Story 4. I felt like no one I knew told me about the first trimester exhaustion. I experienced it with both pregnancies. I literally felt like I ran marathons daily during the first trimester. I was so sleepy no matter how much I slept, ate, or drank. Story 5. I feel like I was pretty prepared, but one thing I did not know about was how the nurses will massage your belly after giving birth to help the uterus return to its normal size. I say massage, but it is more like aggressively kneading dough. Story 6. It hurt so much. I was told, "You won't remember the pain." I remember the pain 20 years later. Story 7. You can get a free sample packet for almost every mental illness during pregnancy or postpartum. Story 8. You can become so exhausted between your contractions that you actually start to fall asleep. Then you are shocked out of your droopy stupor by the next contraction. Story 9. Postpartum depression and postpartum anxiety are real. You can both hate and love that tiny human you just made. Sleep deprivation is not for the weak. It is real, it sucks, and it will never be easy, at least not until your child sleeps through the night. Be communicative about your needs. Don't feel bad for asking for help and set boundaries with people who want to visit. I didn't think my answer would get so much attention. I just shared what was on my mind since I am right in the thick of it at 8 weeks postpartum. Thank you for reading and sharing your thoughts. A Reddit user pointed out that postpartum psychosis is also something that happens. I am fortunate not to currently be in this state, but please, if you ever feel the need, call, talk, and reach out to someone who can help. Story 10. There is no safe zone. People tend to think that once you get past the first trimester, you are guaranteed a living baby, but that is not the case. Also, after loss, you still go through all postpartum experiences, just with empty arms. Leaking milk, bleeding, hormonal swings. Story 11. The sheer indignity of the whole process is overwhelming. Your genital area is exposed for everyone to see. You expose yourself at every doctor visit, and it is obviously exposed during childbirth. If you have a cesarean section, while lying on your back after the spinal block, nurses come in and clean you, all attending to you closely. You cannot move or help because you are essentially paralyzed. Then, if you breastfeed, your breasts are exposed all the time. Motherhood is really not for those who are modest about their bodies. Story 12. Former postpartum nurse here, now working in pediatrics. The number of mothers I cared for who were breastfeeding and were distraught because they weren't producing enough milk and became convinced they couldn't breastfeed was too many. It usually takes about 3 to 5 days for milk to really come in. Until then, you're producing only drops, referred to as colostrum, and generally the baby doesn't need much more than that. Their stomachs are really only about the size of a marble. Also, it's not unusual in the first few days for the baby's weight to drop a bit. They will ideally lose less than 10% of their birth weight but gain it back shortly after. Story 13. How animalistic the whole process is. If you have any fantasies about how special humans are, you will quickly realize that no, we are just chimpanzees with really short hair. Not a bad lesson, really. Story 14. The intense night sweats after giving birth do not happen to every woman. It did not happen to me until about a week later when I returned home from the hospital. Every time I fell asleep, I would wake up drenched in sweat, wet enough to wring my clothes out. Story 15. During pregnancy, heartburn was one of my worst symptoms. Not being able to eat anything tomato-based, including pizza and pasta, was devastating. Story 16. Nausea during labor, especially during the transition phase. If you do not want to vomit, you can have ondansetron. It is very easy to use and has a low risk, preventing vomiting on top of everything else. Story 17. You may get back to your pre-pregnancy weight, but whether you return to your pre-pregnancy shape is uncertain. My hips stayed wide, even at my lightest. Postpartum depression can persist. I have been dealing with persistent depression since 3 days after my son was born. He is 18 now. You will not know how to breastfeed, and neither will your baby. They will have a vague idea, but it takes practice to get it right. Demand equal help from your partner immediately and do not relent. He works all day, so do you. Breastfeeding, changing diapers, and cleaning are work. You deserve breaks too. Take them or he will assume you are doing fine without them. Story 18. How your body reacts is both predictable and unpredictable. You may expect many effects, but sometimes you might experience a random side effect that is the exact opposite of what others have, such as your insomnia being cured. It is truly a roller coaster that you cannot fully predict. Story 19. The extreme shoulder gas pains I experienced after my cesarean sections were unexpected. No one informed me about them. I thought I was having a heart attack. Story 20. Cesarean section recovery. I did not anticipate having a cesarean section, but after 20 hours of labor, we had an emergency cesarean. No one warned me about the recovery process and how difficult it is to recover from abdominal surgery while caring for a newborn. Story 21. That it's life-threatening. I was sick throughout my pregnancy, to the point I had 2 stints in hospital on drips and anti-nausea medication. That almost killed us both. Then the birth 2 months early was traumatic and also nearly killed us. I lost almost half my blood, required several blood transfusions, and spent a month in hospital. Our daughter was in a neonatal unit for 2 months and was allowed to bring her home on Christmas Eve, weighing 4 pounds 10 ounces. My late husband, who was a Royal Marine, had post-traumatic stress disorder from the birth, and he had seen combat by then. He was killed in action when our daughter was 17 and missed her graduation to become a doctor at a children's hospital and her getting married and having twin girls. His photo is everywhere in her house, which is tough for me, even 20 years on from his death. But she was worth all the trauma, and her dad would be so proud of her today. Story 22. Postpartum constipation is common. Include fiber and water in your diet to avoid developing anal fissures. Story 23. Postpartum, especially the newborn period, is very hard. I was so worried about the pregnancy and the birth, and then they handed me this tiny fragile creature, the most precious and valuable thing I have ever had, and said it was time to take it home. I was somehow not prepared for the terror of that. Birth lasts a day or a few days at most, but also, I felt incredible after those difficult months of pregnancy. Story 24. Not a woman, but the baby having the father's blood type was an unexpected pregnancy risk. She had to get the Rogum shot. It is surprising how many women may have either lost a baby because of this or risked losing it by not going to the doctor early. Story 25. Your water breaking feels like a balloon popping between your hips. Baby's kicks feel like a baby kicking you. The whole butterfly feeling lasts about a month. Then it's just a full-sized kid kicking you from the inside out. Sounds magical, but it gets old real fast. Be prepared to be an absolute certifiable lunatic. I'm not an emotional person. I don't have big feelings, and I certainly don't cry in front of strangers. But here's a short list of some of the things that made me sob for minutes. Fried chicken was good. The cat meowed at a bird through the window. The Mars rover exists. A baby panda wasn't born that day. A dollar store plastic spatula bent. My husband said, "Hello, gorgeous." The store did have peanut butter ice cream. My ceiling fan was off when I wanted it on. Also, random strangers are going to touch you and ask very weird, personal questions. For some reason, a segment of the population seems to view pregnant women as public property, like a park bench or stop sign, and feel they have a duty to comment and offer completely unsolicited and unhelpful advice at any time. Learn the art of embarrassing them back. It's hilarious. If your belly skin itches, it means your skin is stretching a lot. Put some vitamin E oil on and do not scratch. That's how you get deep, long stretch marks. Bathe in that stuff. Story 26. How physically strong you need to be before and during pregnancy to have a decent recovery. Unfortunately, your hormones and how your body reacts to them play a big role in the recovery. However, the stronger you are, the better. Postpartum depression involves sudden feelings of hate, rage, and helplessness. Story 27. As a husband who watched his wife go through pregnancy twice, women do not talk nearly enough about how hard that whole process is. I was already a big feminist, but I have never been a bigger one after watching my wife give birth for the first time. I think a lot of women just accept it because it is what they are supposed to do, but as a bystander, I lost years of my life watching my wife go through everything. Also, it differs so much with each pregnancy that you will almost never have the same experience. I also think that men who cheat on women after birth or tell them to get in shape should be imprisoned. Story 28. Regarding childbirth. The pooping during delivery was a secret 21 years ago. Everyone probably knows now, but I was surprised and horrified. As for pregnancy, I had no idea you could actually grow out of maternity clothes. Almost nothing fit me by the time I gave birth to my first child. I had gained 60 pounds. Don't worry, I was only 100 pounds before pregnancy. It seems like I needed the extra weight to carry a 10-pound baby. Story 29. I was worried sick when I had no symptoms other than a growing belly. Story 30. Teeth loss is not uncommon. You know those nightmares about your teeth being loose and wiggling out? That can actually happen during pregnancy. It is not uncommon. Story 31. At least for American women, an epidural is not the only pain management option. There are medications, nitrous oxide gas, and birthing positions that can all be used. The gas is very effective. Contractions can sometimes be felt in the legs, with or without abdominal pain. Each woman and each pregnancy can be different in how contractions are experienced. Story 32. Dysphoric milk ejection reflex or dysphoric milk ejection reflex. I would experience it, and it was very strange. I noticed a pattern of these feelings of dread whenever I would breastfeed. I hated breastfeeding because of it. Story 33. Just how many unusual symptoms can occur? I got gestational carpal tunnel syndrome, and I thought, this is a real thing? The temporarily increased amount of fluid in your body squeezes the median nerve as it passes through the carpal tunnel. No one ever explained this to me, but during the last trimester, I completely lost the ability to feel air temperature and to tell if I was hot or cold. This lasted until about 5 months postpartum. Story 34. You can lose your teeth or your teeth will decay easily. No matter how well you brush, floss, or rinse, you may still develop cavities every time you visit the dentist. Story 35. It is okay to strongly dislike every waking moment of being pregnant but still want to have the baby. Story 36. If I laugh too hard now, I pee. I had a cesarean section, so I presumed I was safe. I laugh at how naive I was then. Story 37. Here is an experience I had, which also affects approximately 3% of pregnant individuals. Pelvic varicosities or varicose veins in the pelvic region, including inside the vagina, can rupture during childbirth. I had at least 2 varicose veins inside my vagina burst when my daughter was born, at the moment she left the birth canal. The friction of her sliding out tore open the veins, and I nearly bled to death after an otherwise low-drama pregnancy and labor. The torn veins also caused a very extensive but superficial tear nearly reaching my anus. I required more than 30 stitches to repair the damage inside my vagina and along my perineum. Fortunately, there was no muscle involvement, and my continence was never affected. Story 38. After a certain point in your pregnancy, it becomes a game of, is this urine, my water breaking, or discharge? For the rest of the 3rd trimester, I had to wear disposable underwear because my baby would kick, and I would accidentally urinate a little. Story 39. You go from having frequent medical attention, monthly, weekly, or even daily visits to your obstetrician, to absolutely no support after you give birth and are discharged. No one checks how you are doing, and you receive no medical care until your 6-week checkup, which determines if you are ready to resume sexual activity. It is unfortunate how women are treated by the medical community. Story 40. Pregnancy is like second puberty with breast growth, mood swings, and body changes. Postpartum is like early menopause with hot flashes, night sweats, hair loss, mood swings, and body changes. Story 41. 1. The bone-weary exhaustion of pregnancy. I was prepared for nausea, not the utter exhaustion. 2. I stopped sleeping through the night in my first trimester because I had to urinate so often. 3. Having a bowel movement during birth will happen. You care a lot before labor and not at all when you are in the midst of it. 4. Bleeding for 6 weeks postpartum was very frustrating. I was unprepared for a 6-week period on top of recovering from childbirth. 5. Even if you get back to your pre-pregnancy weight, it all ends up in different places. Story 42. Not about pregnancy or birth, but about the postpartum period. Nobody ever talks about it, but as someone almost 2 years postpartum, you still get phantom baby kicks sometimes that will scare you randomly. It did not start until about 6 months postpartum when hormones started settling back down. It is absolutely wild and makes you second-guess every period you have afterward. Story 43. Nobody tells you about the identity loss you experience after having children, and it lasts for a while until you discover the new version you have become. Story 44. Losing the pregnancy weight is not the same as returning to your previous body. Breastfeeding can be difficult and frustrating. Your breasts may remain enlarged. Story 45. Just gave birth. I knew automatically when my amniotic sac broke because there was no denying the obvious balloon pop sensation. What nobody warned me about was that with every contraction I gushed more liquid. It was not a one-time gush. This made getting to the hospital harder because I was not sure how to contain the gushes. My husband wrapped a towel between my legs and helped me walk with the crotch sling. There was no denying what was happening when I got to the hospital front doors. I also broke out in many tiny little skin tags all over my neck and chest. They are small and not visible, but I can feel them. Apparently, this is a normal pregnancy symptom. Story 46. If you have a parenting partner, they will show their true colors. Some men can be good or okay partners without children but become terrible partners with children. They cannot cope with the added workload, lack of time for themselves if they actually help with parenting, and not being the focus of your attention. It can be a surprise, and it really hurts to learn this at such a vulnerable time. Story 47. When pregnant, you think the due date is the end goal, as if everything will return to normal then. However, nothing ever goes back to normal, and the birth is just the beginning of a marathon. Story 48. I am going to pick a strange example because I was speaking with someone it happened to. You can suddenly become deathly allergic to something you have never been allergic to before. The person I was speaking to had consumed dairy her entire life. When she was pregnant, she was able to consume dairy through most of it. Towards the end, she was sent to the emergency room after having a glass of chocolate milk. She found out that even after she gave birth, she was still allergic to dairy and said she missed it every day. Story 49. You basically feel abandoned after giving birth because the focus is all on the baby. Family doesn't care, friends don't care, and even your own nurses ask more about the baby than about you. It's so sad, and we wonder why mothers become depressed. Story 50. I did not know until right before my first delivery that one will bleed heavily afterward for quite some time. I guess I thought once everyone was cleaned up at the hospital, that was it. I had read many first-hand accounts of childbirth before I came across this information. Story 51. The number of complications during childbirth that are labeled as normal is astounding. You can fracture your tailbone during childbirth. This happened to me and another woman in my mommy and me group. Normal. Nerve damage or compression during childbirth can cause your legs to become numb, making it impossible to move or walk afterward, sometimes for days. Nerve pain can continue for any length of time. Normal. This happened to a friend. During pregnancy, the body can release too much of a hormone called relaxin, which relaxes ligaments to prepare for childbirth. Excess relaxin can loosen the ligaments in the groin so much that using them becomes extremely painful, making it impossible to roll over or get out of bed without pain. You may need to use your hands to lift and move your legs. Normal. That happened to me. Pregnancy can trigger autoimmune conditions not previously present, such as Graves' disease, which become lifelong conditions. A friend of mine has this condition. These are not hypothetical situations. They are examples from my own circle of friends, and I do not have many friends. I know far fewer women who came through pregnancy and childbirth without some serious complication than those who had significant issues. Because humanity must reproduce to survive, these difficulties are called normal, as if they are not completely debilitating and horrible to endure. Imagine a society where every man loses his right arm at 18. Just because everyone experiences it does not make it less painful or horrible. Similarly, just because every procreating woman experiences childbirth does not make it any less traumatic to the body. Yet, it is not perceived that way. Story 52. Not one person told me a thing about postpartum depression. Not one. I thought I was nuts. I had no idea. This was 1983. They called it the baby blues. No one told me that I might want to kill myself in the shower, that I needed to seek help, or that I was not nuts. Story 53. How horrible some women feel when their childbirth does not go as planned. How jealous and sad you feel when hearing about someone who had the childbirth you wanted but did not get. Story 54. Sometimes the medications do not work. This happened to my mother during her cesarean section, which is why I am never having children. Story 55. You may not instinctively know what to do and may spend a great deal of time trying to figure it out. Being pregnant is not always fun. In fact, when it isn't fun, it can be a misery you cannot escape. Being miserable does not equate to ingratitude or weakness in any form. It is just not something that is talked about often. Unfortunately, pregnancy is fully subject to toxic positivity. Those who say it was the best time of their lives or a wonderful experience are seeing it through rose-colored glasses. Their experience was rare, or they may not want to share any negative experiences for fear of discouraging others or appearing ungrateful or negative themselves. Every pregnancy is different. For example, I have had 3 children and each pregnancy and my state of mind were completely different. Personal examples include: my first pregnancy was a breeze, slightly uncomfortable at times, but I more than made up for that with a very long and excruciatingly painful birth. My second pregnancy was very exciting, slightly complicated, and the birth was very scary and became complicated very quickly. My third pregnancy was miserable, dealing with the paradox of wanting it to end every second while coping with crippling anxiety about the health of my baby and myself was nearly unbearable. The birth, however, was incredibly peaceful and easy. I have learned directly what most say in response to this topic. One cannot anticipate how this experience will unfold, no matter how bulletproof the plan seems to be. This also applies to taking care of and raising the resulting baby and child. The best plan is to accept that there cannot be one. Stay open to the experience and know that this is another season of life meant to teach you invaluable lessons on the meaning of life. Story 56. If you are induced with Pitocin and receive an epidural, even with a high pain tolerance, it may not be effective. Be prepared for this possibility, especially if you have the redhead gene. You may feel like you are experiencing unyielding pain, but eventually the baby will be born and everything will be okay again. Ask me how I know. Story 57. A happy realization I didn't have until my second pregnancy. Babies move differently. My first was a kicker and would regularly get hiccups. He was always moving. The second hardly kicked but liked to stretch and roll. Also, when they get big, you can see them move. I remember the horror on a colleague's face when he glanced over as a little foot pushed out and traveled down my stomach. Story 58. Even with an epidural, you are going to feel the transition when the baby's head is coming through. All 3 babies I had an epidural. All 3 worked great until the final moment of the push, the head. There is a sharp pop that you or I feel even with the medication working. But then it is so quick. The shoulders follow, the baby is out, and suddenly there is the sweet, beautiful baby grabbing at your chest and making the sweetest sounds. You forget about the pain in that moment. Each baby's transition surprised me. I thought I would get slightly used to it by the last and final baby. But no. It was just as intense each time and just as quickly forgotten when I had my baby in my arms. Story 59. A positive pregnancy test does not guarantee a baby. Many people think that pregnancy means a living, breathing infant. That is not always the case. I know. I have had 5 pregnancies and no living children. To have the joy of a positive test taken away and to be filled with dread instead of excitement and hope is quite the experience. Story 60. Breastfeeding hurts. The first week or two felt like someone was slicing my nipples open with razor blades. Story 61. I did not know that I would vomit after receiving the epidural. That was unexpected and it went everywhere. I was crying and apologizing to the nurse who held out her hands to catch it. The labor and delivery nurses are angels. Story 62. No matter how difficult your birth is, once the baby is born, you are largely on your own for all of your self-care, including getting yourself to the bathroom and advocating for yourself and the baby. Most men are not very supportive partners postpartum. There are obvious exceptions, but it is an opportunity for the worst to emerge in many of them. Story 63. There is a significant chance that you tear towards your anus. However, there is also a chance that you tear upwards and injure your clitoris in the process. Story 64. People tell you cervical checks are not necessary. They are if you want to be admitted to the hospital. I refused cervical checks at first. I knew I was in labor. I was screaming in pain from contractions every 2 minutes. But they said unless I let them check me and I was 6 centimeters dilated, they would not help me. I told them I was sexually assaulted in the past and was not comfortable with it. They would not let my husband be with me either. So they waited until I gave up that fight. I let them do one, and it was the worst part of the entire experience. It hurt so much that I had to have them stop before they felt how dilated I was. The doctor finally came in and said they would give me fentanyl and an epidural. Once I got that, and they let my husband be with me, I let them do another cervical check. I did not feel a thing. I was 6 centimeters. I delivered my baby 8 hours later. Story 65. Honestly, how judgmental people are. The endless opinions really stressed me out. Women can be such bullies sometimes. Story 66. You are growing 2 new bodies minimum. Yours and the baby's. Your body, your brain, your emotions. Get ready for a whole new person to come out on the other side. You just might like them or not. Oh, and sometimes the baby does not like you. Took a year for my oldest to tolerate me. She only wanted daddy. Story 67. 1. When your water breaks, it is like a complete gush everywhere. Before my pregnancy, I thought they must add water tubes during the 3rd trimester and did not realize it was natural. They do not put the baby in the nursery like in movies. They put the baby beside you and the child cries all the time so you cannot sleep at all. Story 68. 1. I expected the ring of fire to be the vagina. It is not. It is your anus. Your partner can also experience postpartum depression. Story 69. After my cesarean section and epidural, I could not pass gas and it hurt so much that they put a tube in to release the buildup. That is apparently very common. I had never heard of it. Story 70. Emergency cesarean section can cause uncontrollable shivering and intense cold. It is another level of mental distress to feel your body being pulled from side to side while numb, knowing that you are supposed to feel pain. Until the numbness wears off, the experience can be traumatic. I wish more people had informed or warned me about this. Story 71. How tired I was after my unmedicated birth. It was blessedly quick, but afterward, all I wanted was to sleep and I really felt guilty for not being fully present for the newborn. Story 72. No one warned me that you can get varicose veins in your vulva during pregnancy. They are extremely painful and may or may not go away after giving birth. If they do not, you may need to have them removed. Story 73. The struggle with breastfeeding. I thought you simply placed the baby on the breast and that was it. It was such a struggle with all 4 of mine that I ended up switching to formula faster with each one. With my last 2, I was homeschooling my oldest 2, so it was just easier to use formula. It made me so sad. Story 74. This is strange, but I feel like they don't tell you that you really might not have a bowel movement while giving birth. I understand that it's better to be prepared, but I thought it was inevitable. I experienced both of my births, watched videos, used a mirror, and it just didn't happen. I remember during my first birth, I wondered, aren't I supposed to have a bowel movement? Is it okay that I didn't? My midwife laughed and said, You haven't eaten in 36 hours, and you spent the first few hours of those contractions on the toilet, if I recall. What did you think was left inside you? I felt extremely silly. Also, nothing prepared me for the pain of breastfeeding. I knew it would hurt, but I was not prepared for agony and bleeding on the first day. Story 75. Yes, an epidural really helps, but putting it in for all 3 births was awful for me. Not to scare anyone, but it felt like electrocuting snakes crawling through my back. I think it affected me permanently. I know I am the odd one out, though. Story 76. It is normal not to be glowing and happy during pregnancy. I really thought there was something wrong with me because I was not glowing, always happy, and was very moody. Story 77. If you are planning to get an epidural, say yes when the nurse first asks or request it before you think you need it. Do not wait. The anesthesiologist is busy, and it takes time for them to be found and notified about you. They may already have other patients to administer medication to before you. There is no sense of urgency from the nurses or the anesthesiologist to administer your pain medication if you are not in an emergency situation, and maybe even if you are. If you wait until you are ready, you may experience significant pain before you get the epidural or may even be too far into labor to qualify for the epidural. If only I had known this during my first pregnancy. Story 78. After reading all the comments, I can safely say I do not want anything to do with pregnancy at all in my life. It has solidified my fear of ruining my body if I went through it. I am glad to learn about pregnancy and childbirth before I do anything unwise. Thanks for the information, everyone. Story 79. It felt like my organs were going to fall out of me every time I stood up for the first couple of days while things were settling back into place. It was a strange feeling. Story 80. Honestly, I never imagined I would miss being pregnant. I loved the feeling. I had a rather easy pregnancy compared to some of my friends. Because I was older and had my baby at 42, I was very worried, and every time I didn't feel movement, I panicked. I wish I could have enjoyed it more. I loved feeling my baby move around and kick. It was magical for me. The epidural caused vomiting for 6 hours afterward, which was difficult. Also, the constipation near the end was absolutely brutal. Story 81. How humiliating and dehumanizing it is. If you want a baby, and even if you do not want one now, you have to allow everyone who went to medical school and wants to look at and touch you. Story 82. You need to be vocal about what you need help with. Your partner has no clue what to do either. They need instructions and insight. This will alleviate your resentment and the buildup of anger. Your sanity depends on your ability to communicate. Story 83. How terrifying the first bowel movement after birth is. Also, postnatal depression can manifest as rage or apathy, not always sadness. Story 84. What surprised me when having my first baby was, you get a catheter with an epidural. All the blood that comes out when you stand up for the first time. It was really scary. Story 85. After the baby is born, you develop superhero hearing. Going to the movies becomes obnoxious for a while. You will be able to hear gentle baby coos from 2 floors away through 3 walls. You will also be on high alert for any child crying, with the ability to discern the type of cry, whether fun, sad, hurt, hungry, tired, or scared. Identify who is crying and quickly reach them if needed. There is a reason videos exist showing parents backflipping over cars to catch a child from running into the street. It is inevitable that your child will fall downstairs, usually many times. They will often fall head over heels. However, after some comforting hugs from their favorite person, checking their pupils, wrists, and ankles, they will usually be absolutely fine. Babies and toddlers are incredibly resilient. Their flexible bones go a long way. Story 86. All the hair you lose in the months after giving birth. I had no idea and thought something was wrong. Story 87. Nobody tells you that when you stand up after giving birth, you can feel your organs moving back into place. So not only are you getting used to unsteady legs and your old center of gravity, you are feeling all of that happening too. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.